my God, I learned so much today. And I'm
In 30
curious.
minutes.
I know.
It's
And I'm
like,
curious. I'm like, oh my God, it's already 30 minutes. And I wish we could ask you more stuff.
I have a bigger eye model that I wanted to show you. Dang it, it's blurred out. There we go.
We'll put this on, we can put this on the
Because
YouTube channel.
I know,
Okay,
right?
everybody, this is the big eyeball model.
Right, it doesn't get blurred. So I do
oh
ultrasound
my
from the
gosh.
very front of the eye all the way towards the back. So I look at tumors in the orbit as well. Evaluate the eye muscles for patients with thyroid disease. Sometimes the muscles can get really inflamed and thickened. Sometimes we can get meningiomas or gliomas of the optic nerve. And so I evaluate that, especially in little kids with like NF type 1.
Yeah.
That's one of the big things that we look for. And then we can also look at the iris or the colored part of the eye here. There's a variety of tumors that can arise
Just
there. And
there.
so, right. And then, of course, inside the eye as well. So, I mean, there's a lot of stuff that I look
Yeah.
at that I do on a daily basis, and it's not just looking to make sure that the retina is attached.
Actually,
We do a lot
yeah.
of stuff.
I do remember that because my supervisor did say like, oh, that's why we check them to see if there's a detached retina. And then also our pediatric, like the main radiologist, he's the
Mhm.
one that will usually go with us to scan the eyeball. So it's like, because obviously
Right,
we
like
don't know it. Yeah.
whenever there's like a swollen optic disc, probably, right? They want to make sure
Mhm.
there's no increased subarachnoid fluid. And so I evaluate that too in adults and little kiddos as well. I think the youngest patient I've ever had, and this is one of the crazy ones, the baby was literally hours old. So
Mhm.
this baby was born in a county hospital. And of course, in the county hospitals, the residents are the ones who run the show, running amok everywhere. And so
Yeah.
we had this OB resident who decided to deliver the baby with the clamp. And
Mhm.
so unfortunately, when the clamp got the baby's head, the clamp also grasped the eye, and the resident pulled the baby.
No.
Wait, are we allowed to share this on YouTube?
I mean, we didn't say any names, right?
Yeah,
But
yeah, you're right. But that's
no MRNs
crazy.
or anything,
Yeah.
That is
right?
Oh
no.
my gosh.
And so they were like, everybody was panicking. And so they called the pediatric ophthalmologist, and I was minding my own, but actually I think I was gonna go to lunch at the time. And she texted me, she's like, Jeff, I need you to come with me ASAP. We're going to the NICU. And so I'm like, well, okay. So I grab my stuff and I go with her, and she was like, she kind of, as we were walking really fast, by the way, I was like winded by the time I got to the NICU. She was like, we have to check to make sure that the globe isn't ruptured because of the force, and the poor little baby got yanked. Luckily, there was a little bit of like a cut on the eyelid, but the eyeball itself was pretty safe. There was no abnormalities, no injuries. Of course, the resident was like freaking out. I think he was like in the corner crying,
Yeah.
fetal position
Oh,
himself.
oh my
Oh,
God. Wow. But these
oh
these
my
things
gosh.
happen. I mean,
For sure, for sure. I mean,
they
I have a
do.
bunch of other wild stories that you guys would be like, "What? In ophthalmology? Ophthalmology has fun?"
I know.
Kind of things.
Yeah, because like I would never know. And then you could be just seeing just random, like what's the craziest thing you've ever, was that the craziest thing you ever seen? Like what's like the
No.
craziest thing?
So I think the craziest thing that ever happened to me in general, being a sonographer, is have you guys ever been called to court to testify?
No.
No, I don't want to either.
Oh, you
So
have.
it was a really sad story. So there was this dad. Do you have time? I don't even know if you have time. I'm over here just talking. I don't
Oh,
know if you have time.
Actually, I do not. It is almost 9 p.m. here,
yeah,
and I
Oh
will
she's
my
late.
not.
goodness, I'm so sorry.
But
It's
it's
okay.
okay.
You
You
guys
can
can
tell
keep
me.
recording, yes, and I will
Yeah.
watch it,
Yeah,
and
you
then
can
we'll
tell
have to
me.
have episode 2,
That's why I
so
said
that
we need to have. I was thinking about maybe splitting his episode too, but it's like we'll just get you on another one too. So
For
yes,
sure.
good night, Liz.
yeah. I'll
Good
just schedule
night.
the next
Nice to
date.
meet
Yeah,
you.
I
For
will.
sure.
Yes, nice to
But you
meet
can
you.
tell
Have a
me.
good night. Thank you so much for your time.
Oh, thank you. Bye
See you
bye.
later. Okay, so you can continue with your
Right.
crazy story.
So there was this dad who rushed his baby boy, and when I mean, I think he was like 6 months. The baby came in, was like, "Help! My baby, he's not responsive." And
Mhm.
so they got the baby. They started hooking up to machines and checking his eyes, all that good stuff.
Through the ER, is this happening?
Right. This is through
Uh-huh.
the ER, and of course, because we work at a big academic center, everyone's learning, everyone's
Mm.
teaching, even through the crises, people are still learning and teaching.
Yeah.
And so they called ophthalmology to do a consult because they noticed that there was blood inside the baby's eye.
Mm.
And so I think that the resident who was on call for that shift was I think a second year. This was a while back. So I'm trying to really think how far back was it. And so they call. He was like, "Hey Jeff, I have this baby who with a potential vicious hemorrhage. Can you please come and come with me because I want to make sure that we get all this squared away." And so I get there, and I mean, there's like a lot of blood, like a lot of blood in both
Everywhere.
eyes,
Oh my God, I
right?
can't even imagine.
And so, I
Like
mean, for
in the
me,
eyes?
right? So like all
Oh,
this is filled
in
with blood,
there. Oh my gosh.
right?
Can you see that
And
from like
so
just staring? Or you're scanning and seeing all that?
so right, so the resident tried to look in there, but
Mm.
beyond the iris or the pupil, they couldn't see anything because it was all just dark. Like they
Mm-hmm.
were like it's blood. And so
Yeah.
with ultrasound, I do my ultrasound on the eye. I don't do it over the eyelids, how most people are taught.
Oh, you put it
Right.
directly on. And I
So I
missed I
know
wanted to ask you that during the podcast, but like there was no time to ask that question. So you
so
put the camera on the eyeball.
right. So I numb the eye, especially on outpatient where patients are awake and fully alert. I numb the eye, the
Mm.
surface, and then I put the probe or the transducer on the globe itself, and then I make my sweeps. And so for
Wow.
this baby, the baby was like, basically out of it. And so I still numbed the eye, but as soon as I put the probe on his little eye, I mean, there was just so much blood in there. And I was like,
Mm.
let me look at the other eye. Same thing. So for me, it was a red flag. The resident was just like, documenting, vitreous hemorrhage, blah, blah, blah. And I'm like, so I tell him, I'm like, have they gotten neuroimaging on this baby? And they were like, no, not yet. We're a little backed up. So I got a TCD probe, and so I did a quick, just very brief.
Mm.
There was hemorrhages in the brain too. Do you know
What?
what? Do you know what this might indicate?
Well, how old was the kiddo?
6 months.
6 months?
Mhm,
I mean, like a hemorrhage in the brain? Like two,
mhm.
and so is there like a
But
tumor
and the
rupture?
eyes. That's a good guess, but no. So
No.
I'll go with the story. I'll go with the story. And
Okay,
so
okay.
so finally, they get the MRI and all that good stuff, and of course there was a lot of bleeding in the brain, and they got forensics involved.
Oh my gosh. Wait.
Right.
Wait, is it like when they like shake did they like shake the baby? Oh,
Shaken baby syndrome.
yeah. Oh
Yes.
my gosh.
It was so sad. And
I
so
have yet to see that, which, I'm thankful I haven't seen that, but I've heard of them. So
it's
it's
wild. And
crazy.
so I told the resident, I was like, hey, this looks like shaken baby syndrome. And he was like, what? How do you know? I'm like, there's blood everywhere. And
Mm-hmm.
he's only 6 months and there's blood in the brain. And the baby was basically non-responsive. So he
Yeah.
was declared dead after, I think it was the next day, the baby was
Mhm.
dead. And
Oh my
so,
gosh.
right. And so that's where, they took him to the morgue, the forensics institute or whatever.
Yeah.
They did a full autopsy. And so this is where I came in handy because when, of course, they removed the eyeball, they dissected it to prove, hey, this is not any old regular vitreous hemorrhage retinal detachment. And so on my ultrasound, I mean, it looked like little, almost like spider webs like this in the eye. And I'm like, this is from the force of the shaking.
Yeah.
And so with my little ultrasound probe, little old me, little old sonographer that, knows nothing. I mean, we were able to prove, because we correlate
That.
ultrasound to other neuroimaging to clinical findings, and you put all that together, they're like, it all connects, it all makes sense.
Yeah.
And unfortunately, that dad that brought him into the ER was the one that shook him. I know, it's wild.
Oh my gosh. Wow. So you're part of all that stuff, like you had to do all the
Yeah,
things and
through the
go to
legal set,
court.
right?
Yeah.
Hmm.
Wow. That is insane. And that is definitely something I would remember for the rest of my life if I had that happen to me. So
Yes, I'm never gonna forget that. Unless I get my own brain, hemorrhage,
yeah,
I'm gonna
that's
remember that
crazy.
myself. Yes, wild
Wow.
stuff.
And that's like, people are probably like, because whenever people ask me, like, what's your craziest thing? I don't really know what to say half the time, but it usually has to do with, pregnancy or a
Right.
kiddo or something, but like that one is very unique.
That's
And I
like
don't
way
think,
out there, right?
yeah. And you would never think
Well,
from your standpoint, right? Because you're doing
right, no, because I was
ophthalmology.
just right. I'm like, I'm just scanning eyeballs for a living. I don't know. And
Whoa.
the next thing I know, I'm getting called to court talking about some. Can you explain your
Like
process of scanning? And
findings.
I'm like, I put the probe on the
Oh,
eye. They're like, no, really break it down for those of us who know
ah,
nothing. And I could
wow.
tell the lawyer's face. He was like, as I was like,
Yeah.
well, I put it on the
Explaining.
eye and I make the sleeves and I'm looking at the tissues. And he's like,
Yeah. Because
like
people
almost
have no
disgusted. He was
clue.
like, what?
He's like on your eyeball, which okay,
Right.
because I'm curious when I actually was curious, do most people scan it with the eyelid closed and the probe on the eyelid? Yeah.
Right.
And
Like,
then what if
especially
they
with
open
like
their eye?
well, that's a good, I'm glad you asked that
Yeah.
because I think most of the people that do it like in the ED, they use the tegaderm, right? Because they use
Mm,
the bigger probes, the linear probes. I
yeah.
use my own special
Like
ophthalmic
small.
probes.
Okay.
Right, they're a lot smaller, and so I have more room to sweep around globe and the orbit and all that good stuff. So I don't use the standard gel or methicellose. I
Oh, okay.
use special eye jelly, um, and you can get this like at freaking Walgreens. It's basically just it's literally just like lubricating tears in gel form. That's
Ah,
all
and
it
you
is.
put it on the eyeball directly
But
for
because it's safe
yours.
for the eye, right?
Yeah.
Because it's safe for the eyeball and it's still jelly, it's a good medium to use. Then that's what I use, and
Mm.
it works perfect.
Okay.
Because the other jelly, the general, even
Regular
the
gel
sterile, even the sterile ones can be toxic to the, and they burn really bad, by the way.
to the
It burns,
eyeball.
yeah,
Okay,
to
so
specifically the
people
cornea.
do not try to put gel in your eyeballs.
Not the ultrasound gel,
Yeah,
not
not
the
the ultrasound
ultrasound.
gel. Not
Right.
even like regular jelly, I always make the peanut butter jelly joke with my patients and I'm like and they're always like, "Is it strawberry jelly?"
No, stop it. I have another story. There was this kid, like it's always poor kids, dang it. So there was this one little kid who was making breakfast with his mom. And the mom, I remembered because he said jelly. The mom was making him a peanut butter jelly sandwich.
Hmm.
And while she was doing that, she had bacon frying on the stove. And so the cute little baby wanted to help mommy. And so he grabbed the bacon. And of course, he's short. So when he brings it down, the bacon grease hits him in the eyes.
Oh,
Horrible,
oh
horrible.
no.
Lids burn. The
Uh,
corneas completely scarred.
oh
Um, Unfortunately, the baby had lost his eye because the cornea lost all the innervation.
my God.
So all the stem cells that feed the beautiful cornea and all that good stuff,
Yeah.
uh, completely deprived. So even with the cornea transplant, failed. And
Wow.
I mean, it's people always say like, oh, be careful, watch your eyes, but no, really be
No.
careful and watch your eyes.
Oh my God, yeah. Really be careful. I remember it was
Right,
like since seventh grade, I had to start wearing glasses. And then in high school, I decided to get contacts because I became a cheerleader and I didn't like wearing the glasses, but I flew in the air,
right.
So that was like my start of my eyeball journey, like when I was in middle school. And
For sure.
now I'm always like, oh my gosh, I'm getting more blind and blinder every day. Because, like your eyes change
Right,
every so often.
exactly.
We're all staring at
Yes,
our phones and like, the computers. I mean,
for
I'm just
sure, for sure.
curious. Does that like, do you see that often, those kinds of things like with eye
With
changes, or is
people,
that just different?
right.
That's a
So
different part of it.
in general, the eye typically stops changing, I'll say, after puberty. But for
Mm.
people, especially really high myopic or very nearsighted people, sometimes their eyes still change even as adults. And
Mm.
those are the people that will normally say, oh, you got to be careful because you're more prone to retinal detachments. There was this, I remember there's this one girl I used to work with. She was like a -8, which if anybody's out there's a -8, that's totally fine. You're totally normal.
Are you
But it just
sure?
means that
I'm like
but
-3.
I'm a -3 also.
Okay.
but
Well,
she was
I
the
feel like
mindset.
it's getting worse. I feel like it's getting worse. And I have an
Well,
astigmatism.
also, believe it or not, when we're so concentrated in our work, whether it's reading or on the screen, we forget to blink. I know it sounds crazy because blinking is natural, but we're so
Mhm.
concentrated that our eyes stay open longer and our eyes get really dry. And it feels like, oh,
Ah.
my vision's blurry, my eyes are tired. But in reality, we just got to blink, rest our eyes,
Oh,
and then,
blink.
go back at it. Yeah.
Okay.
But this girl, she's like a -8. And
Yeah.
so I remember I was like, girl, you need to be careful because if you get hit on the backside of your head, it's lights out for you. Because with
Yeah.
any kind of head trauma, -8, the eye's already stretched out. You hit it, that poor little retina is just gonna go boop, detach.
Oh, wow. So is it the
Right.
higher the number? Well, I mean, it's like a
Right.
negative, but like
Right.
the higher the number,
Right. The bigger
it
the negative, right?
the further it gets? Is that what that
Right.
is?
Because so it'll like stretch out. Like
Ah. See,
so
this
the
is why
eyes
I
are
said
never
you should
perfectly
have a
round.
YouTube channel because I would pay attention to eyeball stuff. But
Because
if you're,
eyeballs are creepy, right?
yeah, they are, and they're like
Especially like in movies where they're like,
they're just
stabbing the
staring.
eye. Right. And it's
Hmm.
like, dang it.
It's
Now
like
my field is
painful.
considered creepy. Right.
Yeah. But oh my God, that's so crazy. So literally, like I think you should do, I don't know if you were ever thinking about it, like this is your sign to do it.
Right. This is
Like this
right. This is
this
a
is your
sign.
sign. I mean, you're probably busy with a lot of stuff because you have so much stuff on your plate, I'm sure, with all
Yeah.
your
Yeah.
roles in
Right.
sonography. But I mean, you should do it for fun because that's what Lynn and
I
I
mean, I
started
had
doing.
thought about it.
Yeah.
Right. I remember watching it first and I was like, I could probably do that. But then I'm like, no, nobody wants to learn about eye stuff. No, or nobody wants to
They
because at the
do.
well, see, at the time I'm like, I'm probably the only one that does ultrasound on the eye, and
Yeah.
it's usually just like ophthalmology residents or ophthalmic personnel who are like, oh yeah, I know what that means. But to me, other people are gonna be like,
Well,
I don't know.
maybe you'll get those kinds of people in your audience too.
I
Like
mean,
med students, people who are
right,
just studying the eyeball, and
for
then they'll like
sure, for
come
sure.
across your page. I don't know. I think you should. Comment below if you think he should. Hee hee.
I'll think
But
about it. I'll think about
yeah,
it.
but that's so cool
But
though.
I do post some educational stuff on like LinkedIn. Like not too long ago, I posted one on there's this one guy who he suddenly got a really bad cataract
Hmm.
and his eye got really inflamed, so the cornea got kind of hazy and the doctor couldn't see him there. And so he was like, "Hey Jeff, can you see if there's like a retinal detachment? We don't know why his eyes, looking all crazy or whatever." And I'm going to go a little bit deeper into the types of surgeries and stuff that we do on the eye, but there's a procedure that when there's so much pressure in the eye, um, we have to literally put a shunt in there so that the pressure in the eye can regulate
Wow.
again.
Hmm.
And so, well, the little shunt started hitting the lens with gravity. So, when people walk, stuff bounces. And so
Hmm.
this little shunt kept hitting the lens. And the lens is very, very, very fragile, the little component in the eye.
Yeah.
With any kind of trauma, cataract just automatically forms. And that's what happened to this guy. The
Hmm.
shunt was hitting it so much that it kind of chipped a little. And then immediately it just became cataractus. And
Wow.
I mean, problem solved. I was like, well, he needs a tube revision and cataract surgery. And then after that, this guy will be good to go.
Oh, wow. And you share those kinds of things on your LinkedIn
I do.
profile? Ah,
I don't go super in detail because I feel
yeah.
like a lot of people don't really want to read a whole narrative, but
Hmm.
I will put like this is this because of this, and then the little video
Ah.
of my ultrasound kind of demonstrating what it is that I'm looking at.
That's cool. Well, I'll put your link to your LinkedIn in all
Yeah,
of
that'd be
this
great.
descriptions and everything so that people can find you and see all the cool stuff that you do on the
Yeah.
daily.
Oh, that'd be awesome. They're gonna be like, "What is this guy? What is he really talking? What is he talking about? Talking about some eye and ultrasound."
But I mean, you've been doing this for 12 years, so I mean, and you're still probably learning and seeing things you've never seen before, I'm sure.
And that's a beautiful thing about being in the medical field and being a sonographer and being a teacher is that you will never stop learning. Even if you think you know everything, you will never stop learning.
Hmm.
Um, I mean, I'm pretty sure you come across cases where you're like, oh, well, I didn't know that could happen, but now I know.
Yeah.
So for the next time, especially like patients who have, believe it or not, breast cancer, prostate cancer, lymphoma, that can metastasize to the eye. And so
Ah.
these patients sometimes come to our ocular oncologist, and the only really good way to get a view of all this and to monitor is with ultrasound. So that's where I become really useful and
Mhm.
job security. No, I'm kidding. No, and
It really
that's
is.
that's when I become really useful because I can monitor. And I mean, I've gotten so good, and I don't want to brag, but I've gotten so good that I can tell what kind of tumor we're dealing with without biopsy or without any kind of further imaging.
Wow. No, that I would brag, if I knew all the things. Remember, you're only one of two people in Texas,
For
right?
sure.
That's what you said. So
Yes,
if
yes.
I need an eye ultrasound, I know where to go at least.
Come to Dallas, UT
Yeah,
Southwestern.
that's so cool. Oh my gosh, I love that. So have we agreed that we're gonna create a page? I'm gonna help you create a page. Have you seen the MSK one? There's like an MSK one. Not a
Yes,
lot of people
yes.
do MSK, but there's
Right,
like
it's extremely
one or
rare. Right.
two of them I've stumbled upon, and people go to, and everyone always asks me, and I'm like, I don't know, and then I send them to that. And there's actually like a lot of people who are asking for cardiac ones, and I'm like, I don't know, and then I only know like one person, and then there's not really any people who are consistent and stuff that do
Right. And I
that.
think I think it's because those very niche fields, like I know of a website that a fetal cardiologist, he posts a lot of fetal echoes and stuff,
Mhm.
like almost like a little atlas of the different pathologies that he sees with ultrasound. But of course, he's an MD, and
Mhm.
so I think these really niche fields are usually kind of held with like specifically with like MSK, like um, physical therapists or
Mhm.
chiropractors or orthopedic
Yeah.
surgeons, like they're the
Yeah.
ones who are really going to get into it. And then sonographers that want to learn from that, I think they kind of have to like attach themselves with like, well, let me learn, dang it.
Yeah.
That's kind of how I was.
That's
I
what
mean,
you
in
did.
reality,
Right.
ophthalmic ultrasound was left for ophthalmologists, and they would kind of just do a quick little scan to make sure things are, still intact. But
Mm.
here I come, and I'm like telling them, no, this is happening here, 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 and they're like, oh my god, kind of
Like,
thing.
wow, adios. But that I think also shows for like the person, because if you didn't like, oh, hey, I want to like learn all this, you would have never learned it. And I think
Right.
there's the majority, there's like the hundreds of people who want to go into this field, but then there's that one who's really dedicated to wanting to actually learn and
For
know,
sure, for
right?
sure.
And so I think,
That's really what separates us apart,
yeah,
honestly.
I think I see a lot more people who are very curious and dedicated. And that's why sonographers that do what they do are very good at what they do, because they're very
Right.
curious and they keep on learning and they keep wanting to know. I don't know, maybe one day I'll try to scan some eyeballs.
But you should. No, no, and I'm glad you said that though, because being the only one, and sometimes I want to take some time off, go on vacation, even if
Yeah.
it's just laying on my couch. Um, but it's really hard for me to take some time off because
Ah,
I mean, there's like 30 plus physicians and surgeons who depend on my
you.
scans, my work. And so I remember there was this one girl, one of like the ophthalmic technicians who
Mhm.
was interested, but I think she was interested for the wrong reasons. One, she just
Yeah.
wanted more money, and two, she just wanted to get away from like, I hate to say it, but like toxic coworkers.
Yeah.
And so she wasn't really interested in
In the
what
field
I
itself.
did,
Yeah.
right? She just wanted to do something different. And so I remember I would quiz her. I'd be like, okay, if you have a patient with retinal detachment and there's hemorrhage in the vitreous, what should we be looking for? And she's like, I don't know. Just to let you know, it's usually diabetic patients who have those types of complications.
Mm.
Um, and so she didn't really, she wasn't really capped. And so I'm like, you really don't want to learn.
Yeah.
And so it's really tough for me because, they always tell me, you need to train somebody, you need to train somebody. And I'm
I
like,
was just
well,
thinking that.
who?
I was just thinking that, like, you need to have, oh my God, that's crazy. Do you ever ask people around? I mean, do you like get students? What if I
Not
had like,
sonography students.
I was like, what if I had a student that was like in Dallas that was like, I want to learn everything about the eyeball? Then I'd be like, oh, okay, go message Jeff.
Right. I'm your guy.
Ah,
I mostly get med students and
yeah,
residents.
right.
Um,
But so then they would take over what you do, or not really? Because like they don't want to be sonographers, like they're gonna,
Uh,
or
the
do
med
they?
students, and
Yeah.
so they do it because it's part of like their rotation when they're doing their ophthalmology kind of what's it called, clerkship or elective.
Mm-hmm.
And so they kind of show them a little bit of everything that we do. And ultrasound happens to be a big component in ophthalmology. And so they'll tag along with me for like a couple of patients or half a day, and I'll kind of just walk them through. But it's really tough for me to show them because they're
Right.
just my students. They don't know about the
Yeah.
eye.
They don't know
And
about,
so
yeah.
I can't really go in depth because they're just gonna be like,
Okay.
I don't know. Right,
Yeah.
exactly.
I know. That's
Um,
kind of what happens when I have someone that's like, "Oh, I want to see what you do." I'm like, "Do I waste my time telling you everything about
right,
this? Or
right.
do I just say the bare minimum because I know you're gonna take that info and like it goes out the other ear."
Exactly, exactly. And so, but luckily with med students and residents, especially like ophthalmology residents, I mean, they have to know it. And
Yeah.
I give lectures to them like a freaking seven. I recently did a lecture on them on ultrasound physics. Can you imagine learning about ultrasound physics at 7:30 a.m. and these residents are like half asleep, especially those that like did the night shift. They're just
Yeah.
like acoustic impedance, what? Kind of.
So do you consider yourself really good at physics then? Because you have to
I
do all
mean,
this?
yes. I mean, we have to know physics, not just acoustic physics, but also ocular physics,
Hmm.
because that comes all into play. So when people get cataract surgery, they do a lens implant, and that lens
Ah.
implant is dependent on my measurements.
Yeah. Wow. It's so crazy. I'm gonna tell my some of my Discord members because a
For
lot of
sure.
them in there are very smart and they want to do, XYZ, or like some of them are going to get their bachelor's or they want to get their
Right.
master's, right? But I don't know if they know that you could like do ocular or like,
So
specialize or
the field of ophthalmology is pretty small, and we have
Mhm.
something called the Ophthalmic Photographer Society, which is mostly we have photographers of the eye. Literally, what you're thinking. We take pictures of inside the eye and all the diseases, and then
Ah.
a branch of it is sonography. So on our
Oh.
annual meetings, we kind of all get together and we're like, "Hey, how are you doing?" Stuff like that.
Yeah.
But we have a website, and I'm actually doing a webinar on the 7th on applied ultrasound physics. So physics, but applied to the everyday use of ultrasound. So why
Wow.
is acoustic impedance important in for a sonographer to know? Like, why do we have to know that?
Yeah.
It's not just so we can pass a test. We
Yeah.
know we have to apply that knowledge. We have to apply that physics to the organs, whatever organ we're scanning. In my case, the eye, especially for tumors.
Mm.
Um, I'm going to
Okay.
talk about the different artifacts that we see in the eye. Is it truly pathology, or is it just an artifact? And if it is an artifact, how do we know that it's an artifact, and how can we correct it if it's correctable? For example, for patients that get like retinal detachments,
Mhm.
we put oil in the eye or a gas bubble, depending on the severity of the retinal detachment. And so when I scan, of course, we know that sound doesn't go through gas too well or
Mhm.
oil, right? And
Yeah.
so that changes the physiology, not really, of the eye. So it looks longer, but in reality, that's just an
Oh,
artifact from the
yeah.
oil or the gas. And so I
Huh.
teach them, this is what you do. This is how that looks like. Um, and if you're really looking at for the tissues, this is how you would look at it. This is the approach you would take.
Mhm.
So I'm doing that webinar. I think people are pretty excited about that webinar because, again, there's not very many sonographers, and
Yeah.
people try to do their own ultrasounds at times. And
They don't
to be
know.
honest with you, right, they'll just kind of like wiggle the probe on the eye. They're like, yeah, it
They're
looks
like,
normal. It looks
and
normal.
there's like something completely wrong. What are you doing?
Seriously,
You're doing that is that like something for your guys' group only? Is that like open to the public? Like, what is
it
that?
is. It is open to the public. I
Is that
think.
something you want to promote or not really? You're not promoting it.
Well, I mean, if they want to.
I'm
So
just
I
curious.
mean, I shared it on my LinkedIn and Twitter or
Yeah.
X, whatever the heck it's called now. Um, but I think to actually register for the course, you do
Yeah.
have to make like a temporary account with
Membership.
non-paid. So you don't have
Oh,
to pay for the membership. You just
yeah.
put in your information and submit. That way, you can then, unfortunately, pay for the webinar. I
Yeah.
know, right?
How much is the
I
webinar?
gotta make money somehow. No, I'm kidding. I'm not getting paid. This is actually
Oh.
volunteer time, so
Oh,
so
wow.
I don't get paid for it. But
Uh-huh.
our society gets funds
A
to
part
for us to
of
keep
it.
going and stuff.
Yeah.
Yeah.
Oh,
What was your question?
do you have students going to see that, or like is it mostly doctors? And then like is this something you guys are promoting to
So
sonographers or
it is definitely being promoted. So I have a lot, well, I don't know about a lot, but I have a couple of like colleagues in like OB and vascular and neuro
mm.
who follow me or who we follow each other on like LinkedIn, and so they saw it and they're like,
Mm.
"Oh, I'll register. I'll see what what it is all that you do," because I do share
Oh,
some cases and different stuff that most people don't really think about the
yeah.
eye whenever we're doing ultrasound on the eye. Um,
Ah.
I think it's $25 or $35 if I'm not mistaken.
Well,
And
okay. That's not bad. I was thinking hundreds of dollars or something.
no, because it's just a webinar, so it's not like
Okay.
a
Not a conference or a
right.
multiple
No, it's
day
not like
thing.
that.
It's like an hour.
Yeah, no, literally an hour, and
Do you get
that's it
CMEs? Do people get CMEs or
for
no?
for our stuff.
Webinar?
Yes, right. I don't know if like I don't know if the ARDMS
ARDMS. Oh, but you guys
or
get
the
CMEs.
society. Yeah, we get the. I don't like if other sonographers.
Like, what if I wanted to go to it? Do I get CMEs if I watched it?
I think you get a pat on the back and like congratulations. Now you know about
Now I know about
ophthalmic
physics.
ultrasound. Right.
Oh, oh, well, that's so cool though. I think that's really, maybe you guys should look into doing like stuff for others. Well, I guess it's because it's such a niche thing that they don't do
So
big
I've
things.
tried to reach out. Well, I guess I didn't try hard enough, but like AIUM and
SDMS or
right. But the thing is that and there was an article published at SDMS a while back on intraocular tumors and how I use ultrasound. It wasn't by me. It was I don't know who published it a while back, but I feel like people are interested, but then they're
eh.
um, like, are y'all real or kind of thing?
They
Like,
think it's fake or something, or
right. No,
they don't.
stop. Because sometimes I'll be talking to like my colleagues in ultrasound and they're like, well, I use a Sonosite PX. What do you use? And I'll be like, um, and I'll name my
Yeah.
little machine like I'll use like a quantum medical absolute, and they're like, what? It's sadly it's almost like saying you use an Android, that mentality,
Yeah.
you
Do you
use
drink
what?
Arrowhead water? Just
Right.
kidding. Do you like Arrowhead?
Pepsi Zero for me only.
Yeah, okay.
No, but
Yeah.
so it's like that. So they don't really know what we do or what we use,
Mm.
and so when we explain it, they're like, it sounds like ultrasound, but and they'll like kind of start walking away, and I'm like, wait, no, I know physics. Come back. I'm so cool.
Yeah. Oh, so have you been to those like conference or like
I
having
have
those tables?
for the local ones. I have. I've
Yeah.
attended a couple of cardiac ones and an OB. I mean, they'll talk about it, and I can keep up for the most part. But when they start getting like really nitty gritty into the pathology, I'm like,
You're like, nah.
right? I'm just like,
Like, I don't remember.
I do eyeballs.
And then because at the AIUM one, I went last year in March. I don't know if you
Because
saw, and they had like tables and booths and stuff for all these things, but I don't remember seeing any ocular doctors or ophthalmology.
nobody cares about us. That's why
Oh, I'm
they
like,
forget about ophthalmology.
yeah, because they have like everything else there, and then it's like, except for you guys. Maybe do you have a leading like doctor in your community or like someone that everyone like goes to? Because I know you guys are small,
Um,
but like,
right. In
do you
regards to
know?
ultrasound, or just
Like in ultrasound, like, do you guys know people from all over the United States? I'm just curious. Like that just
yes, for in ophthalmology
hmm
specifically, yes,
yeah.
yes, we do. So we have our own annual conference, and so we just had it actually back in November, where I lectured about intraocular tumors. But
That's your expertise. Oh my
but
God, seriously, like I could do a straight up like just a if you're not gonna do it by yourself, I could just do a straight up one with you and put it on my channel. But like I said, you should do
that'd be
it.
great.
You don't want to
I
do
mean,
it?
I don't even have
This is
I
so
don't even have
easy
the
for you.
I don't have the equipment.
You
I
just
mean,
film yourself like how you are right now.
no, stop it. Because every time I like, even when I take selfies, I'm like, no, I don't like that one. Mm-mm. No, that's not it. That's not
Uh,
it. That's
yeah.
why I can't film myself because then I'll be like,
Mm,
I don't like how I sound. I
it's
didn't like that
okay.
angle.
Then you know what those people are doing nowadays? They're like putting I don't even do this. They're putting like a screenshot in the background and then it's like their body in the front and they're talking. You know how they do that? Have you seen those?
No, I
Like on
haven't seen that.
like it's like there's the information on the screen, like,
Oh,
and
right,
then they're
right,
like
right.
just
Yeah,
talking,
yeah,
and
yeah,
they're like,
yeah.
oh, pointing. You could even do that without your body, like it's just your voice.
Just like my hand, like
Yeah, your
this.
finger, like, yeah. I mean, I don't know. You
I
can make
I mean,
some great content, I'm sure.
right, yeah. I mean, and a couple of the subspecialty fellows that are right now in our program, they'll tell me like, man, if you did this, I would watch it because you don't know how many times at 3 a.m. I have a ruptured globe and I need to do an ultrasound and I don't know what I'm looking at.
Mm-hmm.
And normally they'll text me, but at 3 a.m. I'm asleep. So I
Yeah,
don't get
you're
to that
like,
text until like right
well, do
till
you know?
like 7 a.m.
I'm sure you've seen Henry.
Yeah,
Have you seen
yeah.
Henry? Have you
I
seen his videos? Oh my
I
God, you're
have.
gonna like literally do that, and you could be the Henry of ophthalmology.
Right, right. I'm just like a really shy person. And I know a lot of people
I
say
know.
like, "You're not shy. That you're not shy." And
Yeah.
I'm like, "Yes, I hate people." No, I'm kidding. I don't hate people. But I'll think about it. I mean, people have asked me, like, specifically like at work, they're like, "You should do it
Mm-hmm.
because nobody knows. Literally nobody knows. Even the
Yeah.
attending, like the physicians, they'll come up to me like, "Hey, Jeff, do you think this is a melanoma? Do you think this is lymphoma?" Like seasoned physicians,
Yeah.
they'll come up to me and ask me these like, to the point question, and I'm like, "Well, let's look at the ultrasound," kind of thing,
Yeah.
and
And you know,
we go over it, right?
and I'm sure there's a lot of stuff that you could do videos on. And you could be like Jeff the eyeball guy.
Right.
Yeah, I don't know. That's so cool though. See, I kept thinking like, what could I do that's very specific? But it's like as you see my channel, it's not very nichey because there's so much stuff on there.
Right. Well, I think
But
one of the biggest things about your podcast or even channel is that it's not, I mean, it is about you, but it's not about you. It's about
Mhm.
you, and then you invite people of other in other areas,
Mhm.
or even if they're doing like the same type of sonography in like, I don't know, Alaska or
Yeah.
somewhere totally random, and they're
Mhm.
like, well, so and so is a sonographer in this state, and this is
Yeah.
what they do. Um,
Yeah.
so I think this is what drew me to your channel is because I'm like,
Mhm.
oh, it's not they're not just telling me about the uterus,
Yeah.
or they're not just telling me about multiple gestation pregnancy. They're telling me about
Yeah.
other sonographers that do the same thing somewhere else, kind of
Yeah. Oh,
thing.
yay. Yeah, I love that. And that's funny that you say Alaska because my very first girl I ever interviewed was a cardiac sonographer and she was in
I
Alaska.
watched
Do you remember
I
that
watched
one?
it. Yeah.
It's like she was the very first person I interviewed. And I was like, oh, I could do this. Like, and I
It's a
mean,
thing.
it's fun. Yeah.
Especially for like people who, I don't know, maybe there was a little high school girl in Alaska and she was like, I don't know what I want to do with my life. And then she
Mm-hmm.
stumbles upon this channel. I was like, oh, this chick is in Alaska too. Maybe I can do it, kind of thing. And I
Yeah.
think this is a good thing about your channel is that you educate. It's not just, oh, this is a uterus. And, at 46, not 46, at 36 weeks,
Yeah.
this is what happens kind of thing.
Yeah.
Um, and
Mm-hmm.
this, I guess, this is why sometimes I'm like, I don't know if I want to make a channel because who really wants to learn about the eye like that, kind of thing.
But I
So
think
I,
too, you should also do like your lifestyle, like Dallas, Texas. Like I think lots of people are moving out there, I hear, to
to Dallas,
Texas.
yeah. I mean, I moved here from Houston 2 years ago,
Oh yeah.
so
See?
I believe it. I believe
Mm-hmm.
it.
And
Um,
is it Houston and Austin that like people are moving to?
right. So
And
Austin
Dallas.
is one of the big ones. Right, right, right. I have thought about doing like a little vlog of a day in the life, but it's my day in the life, especially at work, is so random. Like,
Yes, that's the
what's
point.
tomorrow's Friday. Sometimes I'm scheduled in the OR for intra-op ultrasounds.
Mm.
And then sometimes I'm in the outpatient clinic and I'm minding my own business. And then suddenly, hey, Jeff, do you mind coming to the university ED because we have an inpatient who, and they'll describe the symptoms. And I'm like, well, now I have to go do an inpatient ultrasound. And it just varies. So it's not just a outpatient clinic. Like most sonographers, if
Yeah.
you hire for that role or that whatever, that's all you do. I do inpatient, I do intraoperative, I do perioperative, I do pediatrics, geriatrics. No, my span is just so broad that if
Yeah.
I did a vlog, I'll probably be like, all right, guys, I'm going to show you, a day in the life. And then suddenly my phone will vibrate. Sorry, guys, I got to go to OR, kind
Yeah.
of thing. It's
Yeah.
totally random.
But that's also a part of the filming process where you could be like, oh, well, I just came back from the OR. I was in the middle of doing this, and here I was. Because that's kind of how mine is crazy. Like I'm like all over the place in the hospital. But I don't know, I find it so interesting. Like I feel like you have a personality. A lot of YouTubers actually are shy or they're introverted. I don't know if you know that fact, but it
No, I
is.
didn't know that.
And a lot of, I mean, I don't want to say like I don't have friends, but a lot of them are like, oh, like, they create their community, right? And then they
Right,
like
right,
talk to all these people and they make so many friends on the internet, you know. But I
right,
made so many friends just by doing this, and it's really cool to see how everyone is out there and like
right,
everyone's
right.
reactions to your life because they're just like, wow. And I think I could tell by your personality, like I would totally watch you.
My personality?
Yeah.
I'm a millennial. My personality is Harry Potter. No, I'm kidding. No, I'm
Oh my
kidding.
God, people watch that
Um,
too. My friend started a Harry Potter page and she just reached 1,000 followers.
what?
Yeah.
Right?
Just
Wow.
you
And
like
I'm not
Harry
even
Potter?
like a, I'm not even a real one. Like I just
Oh,
watched the movie. I never read the books,
yeah.
and so like one of my best friends, she's like total Harry Potter fan, and she read all the books like twice, and I'm like, what?
Mm,
And so she'll tell me some random fact, and I'm like, I didn't see that in the movie. She's like, because it's in the book. You should have read it. And I'm like,
yeah.
ah.
Yeah.
Like,
I didn't
no,
read the
I
books
can't read
either.
that.
I'm a
No, I just
fake.
watched the movie. Right.
Yeah.
I just watch the movies. That's the only time where I can like turn my brain off and just watch something
A
without
movie.
overthinking it. Right.
Yeah, I
Yeah.
think all sonographers are overthinkers, to be honest. And I tell people it's a good thing. I mean, it's good
It
for you,
is.
it's good for your patient. You're questioning everything and it's a good
I
thing to do.
literally question everything every time I get a patient, even if it's something routine, as in, dense cataract, and we just want to make sure this is like when they're doing like preoperative planning, they just want to
Hmm.
make sure that the back of the eye looks normal. I still ask them my own little exam questions like, do you ever get any eye pain? Do you ever have any eye discomfort when you're looking at different gazes? Because then that tells me if they do have some kind of stuff going on, I need to look at the muscles, not just the retina. Let me look at the muscles. Let me look at the areas around the globe itself. Let me look at the blood flow. What if they have some kind of weird AV malformation, which I've seen, unfortunately.
Hmm.
This patient came in with a headache, literal headache. They saw our neuro-ophthalmologist, and they were thinking, it's probably just a migraine. But on a
Yeah.
whim, the neuro-ophthalmologist said, well, let me send you to Jeff. He's our sonographer. Um,
Hmm.
I scanned a large AV malformation, and
Wow.
I mean, had nobody looked in there, nobody would have
Yeah.
known.
So I'm curious then, because like with all the people going into the ER with headaches and nobody looks at anything, like what? And they just send them home.
Right, like, you're fine, kind of
Uh,
thing. There's another condition that is not commonly diagnosed. So in here, in the little corners of our eyes, it's called the trochlea.
hmm.
It's like a little hook that hooks one of the eye muscles.
Hmm.
And sometimes that little area gets inflamed and it can cause
Hmm.
like really bad eye pain, headache, right? And so one really good way to diagnose it, and I kid you not, I can tell you the many times where neuroradiologists will do their interpretation and say everything looks fine, sends the patient to outpatient ophthalmology. They come to outpatient ophthalmology. They're like, well, let's just get an orbital ultrasound just to make sure there's nothing else going on. And I'm like, this patient has trochleitis. The trochlea is inflamed. They do an injection, problem solved,
Wow.
right?
See, all the things I wouldn't even have known. These people just do
You
injections in their
right.
eyes. Well,
Actually, yes. So especially for patients with diabetes, they get like literally an injection in the eye. They numb it and then they just doop.
and then that's it, solves everything.
Well, ideally,
Well, solves
there's
what
all
they
right, right. I mean, wish we could be, problem solvers like that, but
yeah,
unfortunately,
but it's a
that with
piece of that.
diabetes is right, exactly. Um,
Mm,
but yeah, there's definitely a
quite
lot to
interesting.
ophthalmology that I think a lot of people just don't know, or they're not made aware of
Not aware.
until yeah.
Well, 2024, this is your sign. Because you've been doing this for like 12 years now, and I don't know, maybe you could start doing this for the next 12. They say.
I don't
They
know, yeah,
say.
maybe. I'm like, yeah, maybe.
I don't know
Like,
about that
what
one.
what
We'll
kind of
see.
iPhone do I have? Let me see the camera. Maybe this is a sign to me to
Oh
upgrade my
my
phone. I
gosh.
don't know.
Well, hey, you never know. And then we'll see what everyone says. Well, I'm excited for everyone to see and like just kind of hear about it. Even before you got on, I like told everyone on my Discord, I was like, oh my God, we're interviewing somebody that does eyeballs. And then people are like, huh?
What?
Eyeballs?
Literally every time I get a patient and they're like, you can do an ultrasound on your eye? And I'm like, yep, you can do ultrasound anywhere on the body. Sadly, there's this one time. These are the jokes that I always get. The classic one: is it a boy or is it a girl? I'm like,
In
oh,
your
okay,
eyeball?
right. I'm like, oh, okay. No, this one time, this one guy did say, so am I pregnant? And I didn't know how to. I couldn't joke
In the
back
eyeball?
because, well, because he had a tumor. He didn't know he had a tumor in the eye.
Yeah.
And so he said, "Am I pregnant?" And I'm like, with a tumor," kind of like how I didn't know how to, what I
Yeah,
mean?
how
I was
to
just like,
jab that one in there.
right. So I was just like, I just kind of chuckled and I'm like, all right, well, I'm gonna
Hmm.
show you the way out now.
Yeah. Oh my gosh. No, I usually use a joke where it's like, oh yeah, you can scan the head to the toes. Now I'm gonna add the eyeball in there. I'm gonna be like, even the eyeball, if you didn't know, you scan your eyeball.
Right. You can definitely add that and they're gonna be like, what?
Do you work
Eyeball.
tomorrow? Do you work Monday through Friday? How does that work?
Yeah, I work Monday through Friday.
That's a lot of work. That's a
Sometime
lot. 8
it,
hours?
it is, it is. Well, 8. It's usually 10.
Ah, 50 hours a week?
Yeah. And then this is not including the emails and texts I get after
After.
hours. Right.
Yeah. And you said some of the
So,
students are like at 3 a.m. needing your help and assistance, but you're sleeping.
right. Like, right, I'm asleep. I'm like, when I wake up, I'm like, let me see. Because a lot of them will like send me pictures of their scan and they'll be like,
Ah,
what is it? And I'm
mm-hmm.
like, okay, you only send me one scan. Give me a couple here,
Yeah,
not just
not the one.
it could be anything, right?
Mm-hmm. Hmm.
But yeah, no, definitely send help because I'm the only one.
Yeah. Oh my gosh, that's crazy. Well, hopefully we can get recruit you someone. Hopefully someone's like so interested in it that like they're like
Right. They'll be
they
like,
want to
send me
come.
to Jeff, please. Right.
Yeah. Oh, that's so cool. Well, I'm so happy we were able to get you on.
Oh, thank you. Likewise. I'm glad that I could talk to somebody else about it, not just, coworkers and doctors.
Yeah. No, you can always. And I'm sure, I wonder if like, are your coworkers the same where they talk all the time about it, or are they kind of like I don't want to talk about it right now because you can do it every day,
Um,
5 days a week.
right.
I don't even want to do this 4 days a week, and I'm doing it 4 days a week. So,
Some of my coworkers do, depending on their role, they're like, as soon as they clock out, they're like, all right, done. Nobody talk to me
hmm.
about work. Unfortunately, with me, I can't do that because like,
Yeah, I know. But
sometimes
we're
I'll
always
get,
here.
yeah, for sure, for sure. That's awesome though.
But you should, I don't know. Do you have a Discord? Do you use Discord for anything? No.
Nope.
Do the med school students, I was like, do the
Like, nope.
med school students do Discord? I know
I don't know. That's a good question.
it started off as like a gaming
Right,
thing,
right,
but
right.
then I created one for ultrasound and like then it turned into
Interest.
radiology because everybody wanted to like
Yes.
join like X-ray, but it's mostly ultrasound. So I don't know if you're ever curious if you wanted to join that, you can tell us all the things and you have more people to talk to.
I would love to. I always take the opportunity to teach, even if it's a resident. So
Yeah.
so the residents and I'm like, okay, what am I looking at here? I know what I'm looking at, but I'm asking him, what am I looking at?
Yeah.
Um, well, it looks like a retinal detachment. How do you know? Because this is how I was taught. Since
Hmm.
I was taught with a really old-timey ophthalmologist, he was really tough on me too. He was like, what are you looking at here? And I would question, I'm like, well, is it a retinal detachment? He's like, are you asking me or are you telling me? And I'd be like, I'm telling you, kind of thing.
Yeah.
And so he'd be like, never second guess yourself. Oh, he was really hard on me, but I'm glad that he was
Mm,
because it made me a better sonographer. Because now I
yeah.
think on my toes, I can look at stuff and I'm like, I know what it is. So that's exactly how I teach
Yeah.
the residents. And I'll be like, how do you
Ah.
know it's a retinal detachment? Well, it looks bright. What about it? Why does it look bright? And so I start telling, quizzing them and stuff, and they're thinking finally, and they're like, oh, it's not a retinal detachment. I'm like, exactly. Get out of here. No, I'm playing. No, I mean, it really depends on what the condition is going.
Yeah.
Sometimes a lot of really bad systemic diseases can affect the eye as well.
Hmm.
And so I'll question them about that and be like, hmm, I wonder if there's a systemic condition that causes this. And I'll look at them and they're like, lupus. And I'm like, ah, gold star for you.
Ah, see, and you are way smarter than them. Hee hee.
Well, I was
Goals
well, I
are-
was just going like, because the at that point when my coworker was there, decompressing, and she's like,
Mhm.
"You're literally a doctor." Kind of like how they told you.
Yeah.
They're like, she was like, "You're literally a doctor," and I'm like, "Better recognize." No, I'm fine. No, but I was
I
like,
know, right?
I mean, I
Like,
just know what I know
yeah, it just goes with what you know.
with experience, also, because
Yeah,
at
with
first,
experience.
nobody really just
No
knows
one just
everything
knows
all of a
everything.
sudden.
Yeah, which is
Right,
funny
right.
because I had two recent like new grads. Like I straight up had that conversation with them, and they're like, one of them was through Instagram. She sent me this long message, and she was like, "This is how I feel. Did you feel like that?" And then the other time, I was working with a coworker who was a new grad, and she was like, "This is how I feel. Did you feel like that?" And I'm like, "Yes, everyone feels like that.
Right, right.
Everybody feels unconfident." And I was like, and I actually know exactly when. Like I have a specific day I can tell you when I got my confidence because straight up they ripped one to me. And then I don't know if you were following me at this point. It was maybe like year and a half
Hmm.
ago or two or something like that. And it was about I posted it on my stories about like just like to be confident in what you see and what you know. I don't know. It was a really long thing and I was like really
Right,
upset. And I basically said like, it was a learning lesson for me. And then so since that day, now I'm like confident if I am very confident in what I see and then what I don't see.
right,
And
right,
describing
right.
what you know and what you don't like. I'm confident that I don't know and I'm confident that I know.
Yes,
And
yes.
there is sometimes where you can be in the middle, but if you have like that question, that's where you have to ask about it and like just not be afraid to ask about it or whatever. But
Right, right.
at the time, I don't know if you found out because I don't remember if I told people or not, but it was basically like I scanned a baby and it was just like one baby in there and then everyone kept telling me there was two. Did you ever
Yeah,
see that?
yeah, yeah. Well, I had a very similar experience to that too. This is why I don't do OB anymore. I just never tell
Yeah.
people that.
Yeah.
But no, totally. But I remember what you're talking about.
Yeah.
Yeah.
And I was like, I swear I scanned one. Everyone's telling me there's two. And then like I go back and I scan two because they were telling me there's two. So I made it up and made a
Right.
second baby up. And then like they did the x-ray on the lady and then there was like one baby.
One baby. Wow.
Yeah,
Yeah.
to one spine. And so I was like, my supervisor the next day, obviously he wasn't mad, but he was just like, see, like you need to be confident and like, just be confident in what you saw, la 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 la, all this stuff. But there was like
Right.
so
Right.
many factors. I was like on graveyard, I was tired. This girl had monkeypox. She had a picture showing that she had twins. And then the doctor
Jeez.
was telling me she had twins. The nurse was like, look, there's twins on the monitor. And everyone gets to your head, right? And
Right.
I'm like,
Right.
okay, so
Right.
you guys are all telling me there's two, then there must be two in here.
Right. So, exactly. No, I
Like,
know.
leave me
Yes.
alone. I'm just a sonographer. But yeah.
Right.
But that's the moment where I like, built my confidence and I kept telling these students like you're gonna make mistakes, but just make sure
And
they're not really bad mistakes.
right. Well, no, because that's absolutely very relatable.
Yeah.
And so I'm training a guy right now. An ophthalmic photographer who wanted to learn ultrasound. And I said, you're a good candidate because you already know ocular anatomy from taking pictures of the eye, so it wouldn't be too hard.
Mm-hmm.
But one of the attendings sent a tumor patient. It just so happens that I was out that day, and
Mm-hmm.
so he scanned them, and he said there was no tumor. And so, for whatever reason, the doctor was like, "Let's scan him when Jeff comes back," and there was a tumor there. And so the guy I was training, he felt really he was like kicking air, punching air. He was like
Yeah.
punching himself, and I was like, look, I know it feels like it's not okay, but honestly, it's gonna be fine. One, the patient's gonna come back anyway. They're gonna get another scan. At that point, I'll show you how I do my scans.
Yeah.
That way you can learn from that. I said, no one is perfect. I mean, I am. No, I'm playing. No, no. I was like, no one's perfect. When I was learning, I made mistakes too. We all have to learn.
Hmm.
Live, learn, and grow. That's kind of how it goes. And
Yeah.
and I think that a lot of new sonographers who just graduate, they're confident that they know, but then when they get put in the real world, they're like, oh, do I know? What have I
Mhm.
done? Kind of thing. It's like
Yeah,
you just
it's
be
true.
confident, even if you're wrong. Like you said,
Yeah, be
like you said,
confident that you're wrong.
I'm confident I'm wrong, but
Yeah. No, that's true. But I love ultrasound. I feel like it's such a great field to be in, and it's cool to
yes,
now know that we could go into ocular and like
for sure.
MSK. I mean, even fetal like there's a lot of stuff I don't know. Like fetal hearts and like OBGYN, I don't know. I didn't do full OB scans, being in a
Right, right.
hospital. So,
I I initially wanted to do MFM because for some reason I just love the high risk stuff.
mhm.
Give me the heart attack being it. No,
Yeah.
okay, no, I'm just kidding. But once once I saw like a stillborn, I was like, no, I don't want to do this. Mm-mm.
Yeah.
That's not for me. That's not for me.
Mhm. Yeah. But I'm
Um,
glad that you found something you like.
totally
You know?
random and by accident too, because it's not like I was
Yeah.
researching it. It just kind of went, "Doop. Oh,
Mm.
can I do that? Kind of thing. It
Yeah.
just
I feel like
happened. Here I
that's
am.
yeah, I feel like that's what happens to a lot of people or a lot of just in general. People don't I think opportunities just fall into the
Right.
right place and the right time kind of thing. So,
Yes, 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 absolutely. I
mm.
agree.
Well, it's so cool. I can't wait to like get you and like post everything. But it was a great episode and yeah, we'll definitely have to have you on in the future for
Yeah,
more.
I would anytime, anytime.
And then if you need help with making your own page, you let us know and
I
we'll
mean, I
help you.
wouldn't even know where to start. Like, obviously,
Oh, we can
make a
help you.
YouTube account.
Well, it's first of all, do you want to do Instagram? Do you want to do YouTube? They kind of go hand in hand, so you got to
Oh,
figure out.
Jesus.
You could kind of do Instagram first, or you could do YouTube first if you don't want to do the whole posting thing on Instagram. But then again, you'll reach more, I think, on Instagram.
Right, right, right.
But
I would have to.
there's a need for YouTube. That's for sure. We appreciate it, and yeah, we can't wait to talk to you again in the future.
Oh, I can't wait to talk to you guys again.
Yay! Well, it's nice talking to you and nice meeting
Oh,
you.
likewise, likewise. Thank you so much. Thank you
Yeah,
so
you're
much.
very good at what you do. It's awesome.
Oh, thank you, thank you, thank you. Maybe next time I can do like a shared PowerPoint where I can physically show you like
Can we do like a
has
teaching lesson or something? And I'll just
I
be
would
like
love to just
here.
watching.
Yeah.
I'll share some of my like the lectures that
Uh,
I give the residents where it's like this is this is that, kind of thing.
yeah, that'd be really cool. Okay, but that's like this is the thing though. It's like I don't want to take credit for having the video because it's like it's on my page. But then it's like if you do it, then it's like your own stuff. But then like if you don't care,
Right,
I'm
but
down to have you on my page. I
but am
don't
I really
care.
gonna do it though? Am I really gonna make my own page?
Well, maybe people will ask in the comment sections like, "Oh, da, 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 da," and then we'll go from there. But yeah, I would love to have
Right.
you on whenever you're free. Like, yeah, if you're down to do one,
Absolutely.
can
Absolutely. Whatever
you
you
can
want.
teach me ultrasound of the eye, and I'll be here patiently watching. And then
Right.
other
Like
people
I
can
said,
do
we
it,
can,
like look at it,
yeah,
and they'll
for
be like,
sure.
"Wow, look at this resource I
We
have."
didn't know. Right,
Yeah.
right,
So
for sure.
yeah,
Yeah,
if you're
because
interested.
the likelihood that I'm gonna do my own page is very, very slim.
Very slim. Okay. Okay. Well, as I say, I don't want to take credit, but like I don't mind. I have you on my page.
Take all the credit. I'm happy to share. I'm happy to teach.
Yay. Well, we appreciate it. I appreciate it. And
For
yeah, let me
sure.
know if you have any other questions in the future.
Yeah, for sure. Thank you so much.
Yeah. Yeah, thank you. Have a good Friday and a good weekend.
Right. And hopefully you have a really good shift tomorrow.
Thank you. I hope so. Fingers crossed. All right,
For
talk to
sure.
you later.
Alrighty. Bye bye.
Bye.